Good morning. My name is Marco Martinez. I am a general surgery resident as well as this year's Surgical Simulation Education Fellow at Naval Medical Center San Diego. For today's Tech Talk, I was going to talk about a review of open surgical or advanced procedure simulation models, specifically what is available and what is being used today. For the purpose of this presentation, I have nothing to disclose. I'll begin my talk today by giving a brief background on what modalities are being used in general surgery residency training today. That will be followed by an overview of 3 models, specifically the TraumaMan, some hyper-realistic training models, as well as cut suit and open surgical simulation system. Finally, we'll wrap it up with some discussion points on the types of models being used today. Over the course of a 5 to 6 year general surgery residency training program, a resident can expect to see several different modalities in their training. The first, as in medical school, being human cadavers to teach basic anatomy, but here in residency training it's progressed to teaching specific surgical skills as well as an introduction to surgically handling human tissue. It is used extensively in the Asset Plus course, or the Advanced Surgical Skills for the Exposure and Trauma, which is a fantastic course that is taught at Naval Medical Center San Diego, in which you get vascular exposure to critical life-threatening injuries. And you can also do perfused versus non-perfused cadavers. For a perfused cadaver, you can use that for, say, practicing Reboa access as well as addressing any vascular injuries. In addition to human cadavers, we have in vivo models available to us here at Balboa. These are swine or porcine models. I know the emergency department uses these extensively to practice their chest tube insertions as well as their resuscitative thoracotomies. There's actually quite a robust general surgery protocol where we can use them for the same types of procedures as well as vascular access, vascular cut downs, intra-abdominal procedures that we have available to us. Next are certain models you would typically find in a simulation center. These range anywhere from task trainers such as peripheral IV insertion trainers to minimally invasive surgery trainers, which would typically be like a laparoscopic trainer, laparoscopic box, or robotic trainer, such as using a Da Vinci console to perform simulated surgeries as well as specific tasks. There are virtual reality trainers available today, which sometimes have haptic feedback, sometimes do not. And finally, you have open surgical procedure trainers, which will be the focus of the talk today, and we'll discuss that a little bit more later. Finally, you have hybrid systems, which would be, an example would be a laparoscopic trainer with some cadaveric tissue in it, or a fruit or some other sort of tissue that's being used to help train with a little bit of more fidelity to that tissue model. The first open surgical simulation model I'd like to discuss is the TraumaMan surgical simulator. It's manufactured by Simulam Corporation, and a picture of it is what you see here. This is typically what you'd find and use in an ATLS classroom. Primary uses for this mannequin would be for tube thoracostomy or a chest tube insertion, or a cricothyrotomy or a surgical airway. Pros for this particular mannequin are that A, it's geared towards trauma, it has replaceable parts, it's relatively inexpensive, and that it is transportable. You're able to move it from one place to the other to provide training in different environments. Cons are that it has limited procedure capability for a surgical simulation model. There's a low degree of fidelity, and it lacks a realistic feel of tissues. Additionally, like most models, there's a proprietary replacement parts. I think everybody will agree there's a stark contrast between the TraumaMan mannequin and these next mannequins. Well, these are hyper-realistic mannequins produced by LifeCast Body Simulation out of Great Britain. The company's goal is to produce the most realistic training mannequins possible, and as such, every one of these mannequins is an actual cast from a live human being. These mannequins are incredibly realistic with regards to visual appearances as well as movement of their extremities and the feel of their tissues. Minor procedures are able to be performed on these mannequins, such as venipuncture, intubation, ventilation, but there's no really internal electronic components. All the sensory components are done through the types of equipment you're using. For instance, you need a stethoscope. They'd pump the sound of a breathing or heart sounds into the stethoscope versus hearing them from the actual mannequin. I don't believe you'll find a more realistic training mannequin on the market today. The reason I introduced the hyper-realistic training mannequins by LifeCast Body Simulation is because they produce a surgical simulation model. That model's name is Harley2. It's in a pediatric re-sternotomy surgical simulator. It is specifically used to train for re-sternotomy following open cardiac surgery in the pediatric population. The pros of these mannequins are obviously they're hyper-realistic, which allows you to get more emotionally involved in the training scenario. Additionally, the LifeCast Body Simulation company makes a large age range from 22 to 24 week-old preemies to the elderly geriatric population. Unfortunately, they only have this one surgery-specific model, which is a pro and a con, because if you're trying to practice, learn, or evaluate somebody on an emergency re-sternotomy, this is the model you probably want to have. Con for this model is, as we previously discussed, it really only has that one surgery-specific application, which is the re-sternotomy in pediatric population. These models are so well built and so hyper-realistic that any maintenance on them has got to be fairly extensive in order to keep that realism. And finally, we talked about the emotional ability to really get into the training simulation, but they can also have a negative where you have a lot of emotional toll from having very, very, very realistic looking pediatric models or models, and so you have to be aware of that when you're doing any training event. The final two open surgical simulation models I wanted to discuss in this tech talk are both manufactured by Strategic Operations. The first is shown here. It's what's most commonly called a cut suit, but it also comes with the Advanced Surgical Skills Package combo, and it's a lot of times it's used by the military for pre-deployment training for traumatic injuries. Many of our military members in the audience today will have seen this and or used it in preparation for deployment training. The cut suit is just that. It's a suit worn by an actual live actor. The primary uses for it are everything that you see listed here. For the most part, you have hemorrhage control, you have chest tube insertion, you've got surgical airways, you can do suturing or stapling of the skin, you can insert a Foley catheter or put suprapubic catheter replacement. In addition, with that Advanced Surgical Skills package, you can have intra-abdominal injuries that you can assess and treat, such as liver, spleen, iliac artery, bowel, or kidney injuries. There are a lot of pros to this model, to include a major one being the fact that it is a suit worn by a live actor. That actor can really bring up the realism in a training model by moving around, by voicing displeasure, by screaming out in pain. That's a very key part of this suit. Additionally, this has, as previously listed, a very robust trauma surgery application, including that Advanced Surgical Skills Package combo. The Strategic Operations has a robust support operation, as well as a lot of flexibility. You can write them and tell them what you want to try and practice, train on, and they'll develop some sort of system to place into this so that they can do that for you. Cons for this system, as well as the next system manufactured by Strategic Operations, is that it is synthetic tissue and that doesn't have the feel of live tissue as some of the live models or cadaver models will have. And admittedly, I was not able to get the costs for any of these models for me, but I can't imagine this is a very inexpensive model as compared to the TraumaMan. However, it is much more robust in what it is able to train. The final surgical simulation model I want to discuss is also manufactured by Strategic Operations. It is the Open Surgical Simulation System. Kind of pictured as you see here as in the torso-only portion, but they do have upper and lower extremities that can be added, as well as a head and neck that can be added as well. This model is a trauma surgery training model. You can do thoracic or intra-abdominal injuries on this. You can have a hemopneumoperitoneum, pericardial tamponade, right ventricular laceration, left lower lobe lung bleeding injury, as well as hemoperitoneum, different kinds of liver splenic, as well as kidney injuries, as well as some zone 2 expanding hematoma in the retroperitoneum, as well as a lot of vascular stuff like external iliac artery or inferior vena cava injuries where you need to put a stent in or you need to control the bleeding, as well as small bowel colon injuries, urethral injuries. There's quite a robust system that this is created for. There's a lot of procedures that you can do on this system. I'm not going to read them all off here, but basically they are a plethora of general surgery, trauma surgery procedures. That said, a lot of these same procedures can be done on the cut suit with the advanced surgical skills package on them as well. Pros of this model is that it's obviously a very robust trauma surgical application. Strategic Operations is very good at supporting these mannequins, and they're very flexible. They want to hear from the end user to see if they can develop anything new for these models. And if you ask them to have some sort of injury pattern, they will figure out a way to put that into these models. These models, as well as the cut suit, are fantastic for team training, not just the individual tasks associated with the surgeries, but also dealing with the communication between the anesthesiologist, between the surgical tech, between medics bringing these folks in, as well as transitions of care, as these models are able to be moved in between different transitions. Cons to this kind of model are that it can come in torso only, although you can get it with extremities added. It is synthetic tissue, so it doesn't have the same feel as some other human tissue or animal tissue. And as with anything that can be customizable, it's not going to be the least expensive solution to training. Finally, to wrap it up, I just wanted to make a few final discussion points. A is that there is no universally correct model. So what you're going to want is going to depend on the end user, what type of training you're doing, whether it's just sets and reps and trying to figure out the steps of a procedure, how complex that procedure is, and if you need to have multiple teams or people in on that procedure. All these models over the years have continued to improve on realistic tissue texture and movement, especially those hyper-realistic models. There still is a very real role for cadaveric training as well as live tissue training and surgery. There really, at this point, is no substitute for live blood flow, warm tissue, the specific type of texture of the tissue, how that tissue reacts to your instruments, and that's pretty much here to stay. Again, team training versus individual competencies. Some of these are good for just sitting down, laparoscopic box, or say the TraumaMan, and just working on the muscle memory for a procedure, versus a little more complex team training event where you have multiple people doing multiple procedures on a single mannequin that interact with each other. Again, increasing fidelity is most likely, although I can't say for sure, associated with increased costs. Those hyper-realistic training models, it's going to be, you're not going to want to cut into that model because you're not going to be able to put it back together. And finally, one good point that I'd like to make is a lot of these surgical simulation models really are training decision making versus just doing a task, muscle memory. When you have something that's have an intra-abdominal hemorrhage, The idea is you open up that bottle and you try and figure out where that hemorrhage is coming from and what you need to do to stop that. Not simply just how do I throw a stitch or how do I pack an abdomen. So that's the good thing on all these models. That's it. That's all I have for this tech talk. I want to thank you for your attention, and if you have any questions, please feel free to reach out to me on the discussion boards. Thank you for your time.